research papers and reviewing many international journals. She also offers her technical services to various academic and research bodies in our country. Her goal is to mentor students who can bring evolution in the future while generating research programs and promote interdisciplinary in the country by leading an able team. Ma'am, I invite you to please give the welcoming address.
Thank you, Dr. Shravan. Am I audible?
Yes, ma'am.
Okay, so very good afternoon to all of you, to all the students, participants who have taken out their time from their schedule to celebrate with IIHMR Delhi the World Leprosy Day. Leprosy Day is generally observed every year on the last Sunday of January, and the purpose is to increase awareness among the public about the disease. In India, we observe this day on 30th of January every year. That is Mahatma Gandhiji's Martyrdom Day, as Gandhiji was deeply committed to the cause of leprosy. So this is an opportunity to raise awareness about the disease and to address leprosy-related stigma and discrimination. This year's theme is United for Dignity campaign, which calls for unity in honoring the dignity of people who have experienced leprosy in their lives. So as public health professionals, it is our foremost duty to sensitize the community about the disease, which we think has become extinct, but that is not really the case. In 2005, India declared leprosy as an eliminated disease, which meant that we were able to arrest the prevalence rate of disease to less than 1 case per 10,000 population. But in the recent years, newer cases have started emerging. And what is worrisome is that India houses almost 50% of the world leprosy cases. So this is actually a matter of concern. So with this, I welcome all of you to this event. And I really hope that we all will gain immensely from the discussions and deliberations that take place. Thank you and welcome you all once again.
Thank you so much for your valuable words, ma'am, and thank you so much for that insightful knowledge as well. Now let me introduce Mrs. Divya Agrawal. She is the Associate Dean and the Professor of IIHMR Delhi. Mrs. Divya has graduated from Delhi University in the field of instrumentation. After that, she did her MBA specializing in human resources and finance from Guru Gobind Singh Indraprastha University, Delhi. Ms. Divya ma'am has 18 years of academic and consultancy experience and has diverse knowledge and a complex understanding of how the corporate world works. Being an example and an expert on long-term success for the past decade, she devoted her energy to the investigation of long-living corporations, from supervising postgraduate students carrying out research work in the area of zoonosis, which was funded by an international organization, to carrying out research project on workload assessment of ANMs funded by UNICEF. She is a prime example of a person who has carried out various projects related to strategy and HR Viz, strategy evaluation, workforce planning, competency mapping, talent retention, strategies at the corporate level. Thank you so much for joining us and gracing us with your presence. Ma'am, please introduce us about the IIHMR Delhi College.
Thank you so much, Dr. Shravan, for the introduction. And I would like to welcome all of you on this platform. What a beautiful afternoon where we could see the multiple institutions are coming together on the same platform. And here's a quick glimpse about IIHMR Delhi to all of you. So IIHMR Delhi, it is an institution which was founded in the year 2008, and it had basically focused on the national and international health, and which is looking after the growing needs of the country as well as of the Asia Pacific region. IIHMR Delhi has a major role in contributing, in promoting and in conducting the research in evidence generation, which has led to various health policy formulation, strategic development, and effective implementation of policies and training and capacity development of professionals on the healthcare sector. As far as the activities of IIHMR Delhi are concerned, we are primarily into three areas. First one is the academic, where we offer the courses related to hospital and health management. It's a postgraduate program. We also have a program for the working professionals, which we run on the weekend basis. And then we have a 3-year fellowship program in management, those who would like to hone up their research skills into the healthcare domain. Then the second domain in which we are working in the core activity of IIHMR Delhi is the research, where the faculty and the research staff of IIHMR Delhi is working continuously in different projects of the national and international agencies. Third activity of IIHMR Delhi is into the capacity building or strengthening the capacity of or the leadership or technical and managerial skills of the various health professionals who are catering at either Ministry of Health, and the participants, they come not only from India, but we also get international participants from different countries like Sri Lanka, Myanmar, Maldives, then we have Bangladesh. So these Bhutan, these participants, they regularly visit IIHMR Delhi for their capacity building activities in collaboration with IIHMR Delhi. So that's all which I would like to tell you about IIHMR Delhi. Thank you, and over to you, Dr. Shravan. Dr. Shravan?
Sorry for the technical glitch. Thank you so much, ma'am. That was insightful information on IIHMR Delhi. Now let's see a video on IIHMR Delhi. Thank you everyone for your time and watching that video. Now let's move ahead and let me introduce Dr. Preeta Madam. She is a professor and dean research at IIHMR Delhi. She did her MBBS from Government Medical College Trivandrum, Kerala, and secured her MD in Community Health Administration from the National Institute of Health and Family Welfare, New Delhi. Ma'am has more than 2 decades of sectoral experience, and during that time, she has played a pivotal role in leading and providing key inputs to research projects and activities of the Institute, which have been funded by various national and international agencies. She has also published several articles in national and international journals, and previously has worked with Ministry of Health and Family Welfare and United Nations in various capacities. She currently teaches epidemiology and quality management in healthcare to students of health and hospital management. Please share the program highlights with us.
Thank you, Dr. Shravan, and good afternoon to all the participants. It is only, it is important that we spend some time today in honoring our national program. The national program which leads the fight against leprosy in our country. Leprosy, as we all know, is a very ancient disease. It is associated with a lot of stigma and dread. It has been dreaded through ages, maybe because of the deformities that it produces on the face, the eyes, the nose, the hands, and the feet. I'm sure all of you are also aware of the stigma that is associated with leprosy. Am I audible?
Yes, ma'am, you are.
Audible. So we have our national program, which was launched in 1955. So initially it was a program for the control of leprosy, but during the 1970s, the drugs against leprosy became very popular, and in the 1980s, our government also launched multi-drug therapy against leprosy and changed the name of the program to National Leprosy Eradication Program. We became quite ambitious once the multiple drugs, this multi-drug therapy was available. And it actually helped. This renewed program commitments, the renewed program objectives of identifying new cases and promptly putting them on treatment with MDT or multiple drug therapy with dapsone, rifampicin, and clofas, that really helped in bringing down the prevalence of leprosy from about 58 per 10,000 population in early 1980s to achieving less than 1 per 10,000 in 2005, and as of now in 2021 we have about 0.5 cases per 10,000 population. Lots of other strategies also were there along with case detection and multi-drug therapy, like capacity building, changing the vertical nature of the program into one which is integrated with the general healthcare delivery system, then disability limitation, capacity building of the force, all these IEC or information, education, communication, all these have, of course, succeeded in bringing down the prevalence of the program, has also helped to address stigma to a certain extent. But still, as Dr. Sutapa said, even today, India houses about 56% of the global leprosy burden. So we cannot rest on our laurels. We have achieved a lot. Definitely, the program has helped us achieving a lot, but we do have a vision of a leprosy-free India by 2030. So much leaves to be done. Much is left to be done, and it is very important that the budding managers, budding public health specialists among you also play your role in the coming years to fight this important public health problem. So that is all. All the best for your quiz. Thank you.
Thank you so much for sharing such valuable data and making us understand about the stigma that still persists within our society. Thank you so much, ma'am. Now let's move towards Dr. Gavish Kumar. He has done his BHMS and MBA from IIHMR, Delhi. He is a dynamic public health professional with more than 5 years of working experience in the field of RMNCH+A, nutrition, quality improvement, and NTDs at state, district, and national level. Currently, he's working as a technical consultant to National Leprosy Eradication Program through NLR Foundation today. Today's theme for the quiz will be based on leprosy, so he will be explaining about certain programs. So I welcome you, sir.
Thanks, Dr. Shravan, and good afternoon to all the faculty staff of IIHMR. It has been great that I am being introduced in an event which is being organized by my own college. So today I'll discuss about leprosy, which for which I am currently working. Dr. Shavan, can I share my screen?
You most certainly can, sir. Just give us a few months. Just try
Yeah.
sharing your screen right now, sir.
Okay. Is it visible? My presentation?
Yes, sir. Yes, sir.
Yeah. Okay. So National Leprosy Eradication Program, as the name says, and it has been already discussed that NLEP or National Leprosy Eradication Program is into its advanced stages, and we are working towards eradication of this leprosy as a disease. And we, as ma'am has already said, that we have achieved elimination target, which was, planned to be achieved by 2005 as a national target. So we as a nation achieved that elimination target, but for eradication or continuing that elimination status, a few of our states were not able to achieve that during that time, and still there are a few states which are not able to keep that target due to the heavy transmission of this disease. So we'll shortly go through how leprosy program has evolved over the years. In 1948, it was Hind Kush Nivaran Sangh, which was called, and as Dr. Preeta said, that it was initially started as National Leprosy Control Program. Then WHO, they approved MDT, the name of the drugs, ma'am has already told. And then World Bank assisted this program in India for especially endemic districts in 1994. And then the second phase came, but that was a bit delayed in 2001. And between that, a modified leprosy elimination campaign was run, and ROM therapy was introduced during that period. And then in 2005, India achieved elimination target, which was one of the goals in national health policy in 2002, for which India did successfully well and eliminated this disease as a national, indicator or national target. And then in 2007, PPMR, one of the key components of leprosy program, disability prevention, medical rehabilitation, it plays a very major role in this program. If you will go through the guidelines and the program activities of this leprosy program. And after that, in 2017, this LCDC, Leprosy Case Detection Campaign, and Focus Leprosy Campaign for disability people. Focus leprosy campaigns were introduced, and ASHA-based surveillance of leprosy suspects, that's abbreviated as APSUS. It was rolled out in 2017, and 2019. There were a few innovations in the program, like LPAP, Leprosy Post-Exposure Prophylaxis. This is a drug rifampicin, which is given for controlling or containing the disease transmission. Then Spurs Leprosy awareness campaign, for which we have already been discussed, and it is you can say celebrated all over the world as a World Leprosy Day on the last Sunday of January. And we in India, to value or respect our father of the nation, Gandhi ji, we commemorate or we observe this day as anti-leprosy day in India. And Gandhi ji, as he did a lot for leprosy affected, and his one of his dearest friend, uh, he also suffered from leprosy. So it is being related to Gandhi ji, and we pay almost tribute to him. His friend was Shastri ji. I'll let you know. The name is not clicking right now. And Nikusht, one of the health information management system, it was included in 2019. And in 2019, as it has already been told that the vertical aspect of this program, it is being included with, or collated with other programs. So Ayushman Bharat, the CBAC component which Ayushman Bharat holds, it has 4 questions which help in leprosy screening. And RBSK, Rashtriya Bal Suraksha Karyakram, those RBSK MOs, they also play a major role in finding out the leprosy cases. And ACD, active case detection, and regular surveillance guidelines, they were rolled out in 2020. This is a larger version of the 2017's LCDC guidelines. and RGSK program, Rashtriya Kishore Suraksha Karyakram. It is being rolled out currently. So this is the hierarchy how this NLEP program works throughout India. Central Leprosy Division, which is in Ministry of Health, they are the main strategy makers of this program in India, and they go hand in hand with the NHSRC, CLTRI, Central Leprosy Training and Research Institute. Similarly, regional leprosy training research institutes are there, like Jalma, it is in Agra, and other institute is in Naini and ICMR, and other institutes of national importance like AIMS. They play a major role in developing strategies and any upgradation if required. So they all collaborate and they strategize all those things. And under Central Leprosy Division, state leprosy offices are there, where state leprosy officers, they work under or with MD and RHM and other health verticals like RBSK, RKSK. They work with them, and they roll out the programs in district and the field. As you know, the block medical officers are at block, and CHO, the Ayushman Bharat component at health and wellness centers, and ANM sub centers are there. And in the field level, ASHA, MPW, and PMW, they work for an LP program. This is the current scenario, how data has moved over the years, and we are, at national level, we are at a very comfortable position. But since you can say the ANCDR, that's an the incidence rate of this disease and prevalence rate, they are almost stagnant since 2005, since we have achieved the elimination level. So we need to work upon it. And grade 2 disability, this is the graph of disability, the new disability cases in all the cases we find during the year. So the disability graph is quite, it's going up and down. It is not that, in in a particular direction, which we can say it is going in a better direction. So grade 2 disability cases are being found more. We can say that the case finding activities are better nowadays, but still we have to contain that because it causes a lot of harm. If a person is disabled, he is not able to perform his daily tasks, and he is almost considered as a burden, which usually the thing which we were talking about, stigma, it increases the level of stigma within the society. So the current strategies which we are implementing all over the world, this is the global thing, which global data, as ma'am has told, that 56% last year was contribution of India among all the leprosy cases throughout the world. But 80% of global leprosy cases are found in only 3 countries: India, Brazil, and Indonesia. And in these 3 countries, India is the major contributor of new leprosy cases. And 5 countries: Brazil, Indonesia, uh, India, and Bhutan.
वॉशरूम जाना वॉशरूम किधर है इधर
Kajal,
So
please mute
they,
yourself.
I'm sorry for the technical difficulty, sir. Could you please continue?
hello, hello.
Gavish, you can speak.
Okay, so okay. Global, the global scenario is 80% of the leprosy cases are found in India, Brazil, and Indonesia, and major contributor is India. Almost 60% of cases we have been contributing since last 5 years. So we need to work upon it, and the strategies which we are rolling out globally, and the we have ILAP agencies, in which is International Leprosy. International Foundation of Leprosy, Anti-Leprosy Associations. That the word is in French, that's why it is ILAP, and the meaning is quite different. And WHO, they form the global STAG. So they strategize these things, and the vision of global leprosy strategy is zero transmission, zero disability, and zero stigma. And it has been these three component in the vision has been kept in 2030 is this global leprosy strategy also, but the targets has changed. So earlier it was zero new child cases with disability, and new grade 2 disability case was expected to be less than 1 per million population. And discriminatory laws are still there throughout the world, so they targeted to achieve zero discriminatory laws. And in the newer global leprosy strategy, we think that a majority of the cases that in the first line, as it has been mentioned, that 80% of global leprosy cases are from India, Brazil, and Indonesia. But if we will talk about 100% leprosy cases, they are almost from 120 countries, and all of them, they have tracked or retrospectively assessed that there are the migration play a major role. So they the word that autochronos cases, this has been mentioned in the newer leprosy strategy, and they want to they have a target of taking down this autochronos cases, the migrated cases, to zero by 2030, and 70% reduction in annual new leprosy case detection, as baseline would be 2020 data. 90% reduction in new cases with grade 2 disability per million population, and 90% reduction in the child cases. So this is the global thing which is there. And as per Indian scenario, currently, even after 15 to 17 years of working towards leprosy elimination and working towards eradication, Chhattisgarh and Dadar and Nagar Haveli has still not been able to achieve elimination targets. And strategies which are currently into play in India are national health policy. And it aims to achieve and maintain elimination status. It is a leprosy strategy which we are going to follow by till 2025. But by 2018 it was expected, but we have not been able to achieve. Of course, COVID has played an important role, but we have to achieve it anyhow. And ACD and RS, as I mentioned, active case detection and regular surveillance program, and APSUS, this ASHA-based surveillance of leprosy suspects. Then this leprosy post-exposure prophylaxis, NICUST, which is a HMS portal, and this integrated approach. These are the strategies Government of India follows. And innovations are, of course, LPEP and LPEP. This PEP plus plus thing is also going on around the world, and trials are being conducted. So currently we are going with one dose rifampicin, which will help in controlling this disease. But in the coming years, the trials are being made for 3 drugs. It is a combination of 3 drugs which will help in controlling this disease. This is AMR, antimicrobial resistance. This research is ongoing, as we have found multiple AMR resistance cases in TB, which is almost a similar disease, and the causative agent is from the same family. So research activities are going on in this field. And vaccine trials, this MIP vaccine, it was jointly rolled out, or the trials were conducted under the leadership of DDG Leprosy, Dr. Anil, and ADG Leprosy, Dr. Rupali. They started this with IIHMR, and the subsequent phases of trials are being conducted, and soon we'll have this Mycobacterium indicus parani as a vaccine for leprosy. Azadi Ka Amrit Mahotsav, as you might have seen in every program, in every health program. So there are few indicators which we were planned to achieve, and certain activities are for leprosy also. The 3 activities which NLEP will be doing is screening of 40 crore population of leprosy through ACDRS, and by first week of October, it was expected to screen 15 crore population, but due to COVID and other limitations, the target was not achieved. By June 2020, to 40 crore population is expected to be screened. And SPURS leprosy awareness campaign, that's SLAC, which we are discussing, the 30th January activity which we do every year. This is totally a IEC activity which we through which we try to raise the awareness. Mascot is Sapna of this Spurs campaign. So we do a lot of IEC activities under this program. So this was one of the activities. And third is reconstructive surgery. It is one of the major components. If disabilities set in and you're not able to, control them via, our services, then we have to do the, RCS. So this is the target. These are the deformities which you might, notice in leprosy. This is a self-care we, advise for different part of bodies. Challenges are these three challenges: disease-related, programmatic, and social aspect. Disease-related are, as this is a chronic disease, longest incubation period it has, so early diagnosis and treatment is a challenge for us. It has a longer treatment, and the duration of treatment is longer. It is almost for 6 months or 12 months. So to drug compliance is one of the other challenges which we have. Disability is also a problem because once the disability is set in, so it is difficult to reverse it. Programmatic stakeholder involvement, we as this is one of the entities neglected diseases, so stakeholder involvement is a challenge for us. Surveillance strengthening as observed by WHO and AMR and other things are being focused now. Migration tracking as the global leprosy strategy has focused. So these are few challenges, and other the social aspect, myths, stigma, they are related to leprosy. Acceptability is very less, and dependency is increased in this disease due to deformities, and ultimately it leads to poverty and expenditure is high, quite high. This is all from me. Thanks.
Thank you so much, Dr. Gavish, sir. Thank you so much for sharing on how the National Leprosy Control Program involved into the National Leprosy Eradication Program and explaining us the strategies in detail. Thank you so much, sir. Okay, Ambi, can we move forward, Ambi? Okay, Dr. Vishal will be introducing the teams to everyone. Dr. Vishal, are you there?
Yes, sorry, there was a small technical glitch. So there are 29 teams, out of which 4 teams have pulled off, which is 5 teams, sorry, which are Team 2, Team 6, Team 12, Team 21, and 22. I will introduce the teams now. Team 1 is from Delhi Pharmaceutical Sciences and Research University, consisting of Sapna Yadav and Dr. Aditya Kukreti. Team 2 is from Chandigarh Group of Colleges London, Mohali, consisting of Vipul Khanna and Aarti Jagga. Team 3 is from Tata Institute of Social Sciences, consisting of Dr. Nimisha Maheshwari and Dr. Gunjan Sharma. Team 4 is from AIIMS Jodhpur with Divya Gehlot and Kajal Taluja. Team 5, North Bengal Medical College and Hospital, consisting of Navarnal Deb and Polami Roy. Team 6, Department of Pharmaceutical Sciences, MDU Rohtak, consisting of Nitin and Lokesh. Team 7 is from IIHMR Delhi, consisting of Dr. Lipika Singh and Dr. Afreen Hussain. Team 8 is from Chandigarh Group of Colleges, consisting of Bipasha Singh and Asta. Team 9 is from IIHMR University, Dr. Rennie Thomas Light and Glory Samal. Team 10 is from Department of Pharmaceuticals, Maharishi Dayanand University, Rohtak, Nisha and Gurvinder. Team 11, National Institute of Public Health Training and Research, Mumbai, consisting of Dr. Gauri Tilak, Dr. Mahiri Rak. Team 12, Anil Neerkonda Institute of Technology and Sciences, consisting of Jaswant Manohar and Mohammad Gulkhan. Team 13, consisting of Tata Institute of Social Sciences with Siddhi Chaudhary, Himani Goyal. Team 14, National Institute of Public Health Training and Research, Mumbai, with Damini Goyal and Dr. Suyash Lokras. Team 15 from IIHMR Delhi again, Shreya Wadhwa and Dr. Vaibhav Sundrial. AIIMS Jodhpur is Team 16 with S. Varuni, Ishani Chadda. Team 17, Government Arts and Science PG College, Ratlam MP with Dil Nawaz Jafri and Mukul Verma. Team 18 IIHMR University Jaipur, Adamaya Singh Bayas and Riya Ranjan from that team. Team 19 is Anin Neerkonda Institute of Technology again with Yogita Pukkala and Vasudha Kuchadia. Team 20 is National Law School of India University with Pallavi Tibarwala and Nutan Tibarwala. Team 21 Agra College, Janvi Pathak, Purva Chaturvedi. Team 22 GMER's Medical College, Sola, Ahmedabad with Sandeep Padayachi and Urvasi Patel. Team 23 is from JIPMER with Dr. Mahadevan D and Dr. Vishwanath N. Team 24 SOA deemed to be university consisting of Priyadashini Swain and Darashri Nayak. Team 21 is from Osmania Medical College, Hyderabad with Syed Mohammed and Naveed Mohammed. Team 26 is IIPhD consisting of Risha Premjit and Mandavi Singh. Team 29 is RVS Agricultural College, Tanjavur consisting of Manikandan A and Manoj M. So could we move on to the next slide?
Thank you so much, Dr. Vishal, for the introduction of the teams. Now, let me go and let me explain you about the rules and regulations of the whole event. Now, as per knockout fixtures, each team will face off against each another team to proceed to next round. Each question will have a time window of 10 seconds to be answered. The team to raise their hands first within the time limit will get to answer the question. In case of wrong answer, the question will be automatically passed on to the other team in the matchup. Additional quiz questions may be asked to settle any tiebreakers in the matchups. Now, for the participant rules, contestants should keep their videos switched on only when it's their turn for their matchup. Second, microphone should be on mute at all times and should be unmuted only when instructed or when it's turn of the team. Contestants' gaze should be always directed at the camera or screen. Contestants will be observed to ensure fair play. Contestants should raise their hands when it's their opportunity to answer in a matchup and lower their hands after each matchup to avoid any confusion. Failure to follow these rules may lead to disqualification, and we expect everyone to maintain the decorum. Please move to the next slide. So these are the fixtures of the team. Now we know we are holding out a knockout fixture. Now within the nature of knockout, since we had 29 teams, few teams will be directed to the second round directly. Now let me make you understand on how this will go further. The first round will have 13 matchups, first questions per matchup. Second round, there'll be 8 matchups in which again, 1 question per matchup. Now when we advance to the third round, there'll be 4 matchups, but there'll be 3 questions per matchup. Now for the fourth round, there'll be 2 matchups. Again, there'll be a 3-question matchup over there. And to the final rounds, to the winner and the runner-up, there'll be 3 questions for the final matchup. Now, keep this in mind. The prize money of the quiz is for the winner, it's 10,000, and for the runner-up, it's 8,000. With that, we will move ahead, and I will hand over the conduction of the quiz to Dr. Vishal.
Yes, so we can go on to the next slide. Yes, let me introduce the teams again. So in round 1, the first question will be directed at team 1 and team 2. Now, since team 2 is absent, so team 1 will be walking over team 2, and team 1 consists of Sapna Yadav and Dr. Aditya Kukreti from Delhi Pharmaceutical Sciences and Research University. So we can proceed on to the next slide. Yes. So if team 1 wants, they can answer this question in spite of not having a competitor, team 2. So which is the disease which is closely related to leprosy? So this is a question for team 1. You don't have to worry about getting it wrong, but you can still attempt it.
TB.
Yes, that's the correct answer.
Yeah.
Team 1, Sapna Yadav, congratulations. Yeah, that's the right answer.
Dr. Vishal, sorry for interrupting. To every teams, as I had announced in the rules, you are not supposed to answer. You're only supposed to raise your hand first, and you will be announced. Your name or your team will be announced by us, and then only you are supposed to answer the question. Thank you so much.
Excuse me, sir.
Yes.
Sir, I have one query that I have to raise the that reaction raise hand, or on video I have to.
Yes, you have to raise a reaction.
Okay, all right. Okay.
Thank you so much, and I hope every other team follows this rule.
Yeah, sure.
Also, you'll have to switch on your video, okay?
While answering the question, I request the teams to switch on their video when it's their turn. So I'll be again mentioning which teams will be competing for the question. So now over to the next question between Team 3 and Team 4. Team 3 from Tata Institute of Social Sciences, Dr. Nimisha Maheshwari and Dr. Gunjan Sharma, and Team 4 from AIMS Jodhpur for Divya Gehlot and Kajal Taluja. So the question for you people
Both
is,
the teams, please switch on your
on,
videos.
Yes, please switch on your video. Team 3 and Team 4, I request you to switch on your video and be ready to answer the question when the timer clicks. So our Team 3 and Team 4, have they switched on their videos?
Yes.
Yes, thank you. So the question for Team 3 and Team 4 is, so which form of leprosy affects the internal organs? So here the timer starts now.
Team 4 will get the chance to answer.
All right. So Team 4, the first person to raise the hand was, I think, Divya. So what is the answer for this question, please?
Lepromatous leprosy.
Yes, you are right. Congratulations, Team 4, to Divya for getting the right answer. I apologize to Team 3 because since they raised their hands first. So Team 4 will be proceeding on to the next round. So the next question will be for Team 5 and Team 6. Team 5 from North Bengal Medical College and Hospital with Naomi Deb and Paulami Roy. And Team 6 from Department of Pharmaceutical Sciences, MDU Rohtak with Nitin and Lokesh. Please switch on your videos and be ready to answer the question when the timer clicks.
Sorry to interrupt, but Team 4, kindly lower down your hands.
Yes, Team 4 can lower down their hands since their turn is over. So Team 5 and Team 6, I hope you have switched on your videos. Yes, so now over to the question. For Team 5 and Team 6. So I really apologize for this. Team 6 is actually absent. So Team 5 can still answer the question regardless. Please move on to the next question. Yes, so the Team 5 can answer this. Leprosy has an incubation period of Team 5, you don't have to worry about getting it wrong since Team 6 is not there. You'll be walking over, but you can still attempt this question. So may I ask either of Novolil Deb or Polami Rai, could you, if you can guess the answer, or you can, if you know the right answer, you can take an attempt. Is Team 5 there? All right, no, not an issue. We'll move on to the next matchup. So Team 5 moves over to this thing. The answer for this is, Ambi, you can go to this. So it's 2 to 5 years. 5 years is the maximum range. All right. So now the next question will be for Team 7 and Team 8. Team 7 from IIHMR Delhi Dr. Lipika Singh and Dr. Afreen Hussain, and team 8 from Chandigarh group of colleges with Bipasa Singh and Asta. So please be ready to answer the question when the timer clicks. So the question for team 7 and team 8 is, name the drugs under multi-drug therapy effective against leprosy. You can raise your hands if the timer starts now.
Team 7 will answer.
Yes, team 7, Dr. Afreen, please answer. I guess Dr. Afreen.
Rifampicin, Dapsone, clofamicin.
Yes, that's the right
hear
answer.
me?
Congratulations, Dr. Afreen from team 7. So you will proceed on to the next round. So the next question will be for team 9 and team 8. Team 9 from IIHMR University, Jaipur, with Dr. Reni Thomas and Mansu Bhatta, and team 10 from Department of Pharmaceuticals, Maharishi Dayanand University, Rohtak, Nisha and Gurvinder. So team 9 and team 10, the question for you is, in India, when is the Leprosy Day celebrated? Yes, team 9, Glory Samal and Dr. Reni have raised their hands first. Yes, you can answer the question.
Yeah, the answer is 30th January.
Yes, that's the right answer. Congratulations, team 9. Glory Samal has answered the right answer. So the team 9 moves on to the next round. The next question will be for team 11 and team 12. Now, since team 12 is not present, team 11 can regardless answer the question. You don't have to worry about the consequences. So the question for team 11 and team 12 is the question. Yes. So the World Leprosy Day was chosen by French humanitarian Raoul Ferrero as a tribute to the life of which person? Your timer starts now. Team 11, Dr. Gauri Tilak and Dr. Mayuri Rao. You can answer the question.
Mahatma Gandhi.
Yes, that's right. Congratulations, Team 11, for getting the right answer. Dr. Gauri has answered it correctly. Yes. Now we will proceed on to round 1, Group B. Yes. So the first question will be for team 13 and team 14. Team 13 from Tata Institute of Social Sciences with Siddhi Chaudhary and Himani Goyal, and team 14 with National Institute of Public Training and Research, Mumbai, with Damini and Dr. Suyash. So the question for you people is, team 13 and team 14 is,
Please switch on your video.
Please, I request the participants when I'm introducing, please switch on your videos and be ready to answer the question and raise your hands as per this timer. So team 13 and team 14, I hope you have switched on your videos. The question for team 13 and team 14 is, for how much duration the treatment regimen of leprosy should be taken? So team 13B, Himani has raised her hand first.
6 months to 1 year.
Yes, that's the right answer. Congratulations, team 13, to Himani for answering the right answer. It's 6 months to 1 year. So team 13 will proceed on to the next round. Now the next question is for team 15 and team 16. Team 15 from IIHMR Delhi, Shreya Wadhwa and Dr. Vaibhav Sundarya, and team 16 from AIMS Jodhpur, S. Varuni and Ishani Chadha. So please switch on your videos and be ready to answer after raising your hands. The question for team 15 and team 16 is, in which year the global leprosy strategy was devised? Yes, so team 16, as Varuni has raised her hands first, please answer.
1955.
Yes, that's the right answer. So, sorry, that was the wrong answer. Ambi, please could you move back?
We'll go for a tie-up round for this
Yes,
question.
since that was a wrong answer, we'll go for a tiebreaker question. Since due to a technical glitch, the answer was revealed. So there'll be a tiebreaker question. Okay, so for team 16 and team 15, what could happen if leprosy is left untreated? A, blindness, B, crippling of hands and feet, C, paralysis, D, all of the above. So
Team 15 will answer.
So
It's all of the above.
it's all of the above. That's the right answer. Congratulations, team 15.
excuse me.
Yes. Any doubts from team 16?
We had raised our hand.
Yes, sir.
I didn't
Yes, sir.
understand.
We raised our hand due to technical glitch. It was late, so we raised in the video only.
All right, but as per this thing, team 15 was appearing on the first this thing. Really apologize for this thing, for the opportunity lost. Better luck next time. And congratulations, team 15. Now the next question will be for team 17 and team 18 from Government Arts and Science PG College, team 17, having Dilnavar Jaffrey and Mukul Verma, and team 18 IIHMR University Jaipur, Glory Samal and Tanisha Jain. So the question for team 17 and team 18.
Excuse me, sir. Sir, you have taken the wrong names actually for team 18.
So it's Ria Rajan, is it?
Yes, sir. Adamya Bes and Ria Ranjan.
Danya?
Adamya, sir. Adamya.
Adamya. Okay. I deeply apologize for the miscommunication. So Ria and Adamya from team 18 IIHMR Jaipur University. The question for team 17 and team 18, I hope you're ready to raise your hands. The question is, who discovered the causative agent for leprosy?
Team 18 will answer first.
Yes, team 18 will answer first. Ria Ranjan has raised her hands. Please answer.
Sir, it was G.A. Hansen.
Yes, that's the right answer. It's Gerald Henrik Armour Hansen. He has discovered the causative agent for leprosy, and this was the first disease-causing bacterium to be identified in human beings. So this was the right answer. Congratulations, team 18. Congratulations, Ria. So team 18 proceeds to the next round. So the next question will be for team 19 and team 20. Team 19.
Sorry to interrupt. Team 17, kindly lower down your hand.
Yes, you can lower down your hands once your turn is over. So the question for next question is for team 19 and 20. Team 19 is from Anil Nerkunda Institute of Technology with Yogita Pukala and Vasudha Kuchadia. And team 20 is from National Law School of India University, Pallavi Tiberwala and Nutan Tiberwala. So the question for team 19 and team 20, I hope you're ready with your video ons to raise your hands. The question, please. In which year World Leprosy Day was established? And your timer starts now.
Team 19 will answer.
So team 19, Vasudha has raised her hands first. Please
1955.
I'm sorry, that's the wrong answer. The question goes on to the next team, team 20.
1954.
Yes, that's the right answer. Your team 19, really sorry, you were very close. It was 1954. So congratulations to the team 20 on getting the right answer. Now, the next question will be for team 21 and 22. Both the teams have been absent. So it will be the next question can just, we can zip past it to the next team. You can go on to round 2B.
Can team 19 please lower their hand down, please, Mrs. Vasudha Kuchadia?
Yes. So team 21 and team 22 are not there. So the question is not being answered by anyone. We'll move on to round 2B, group B. Yeah, so the next question, sorry, I apologize for that. The next question will be for team 23 and team 24. Team 23 from JIPMA, Dr. Mahadevan D and Dr. Vishwanath N. Team 24 from SOA University, Priyadashini Swain and Dharashri Nayak. I hope you have turned on your videos and are ready to answer the question. The question for team 23 and team 24. Yes. By which year National Leprosy Eradication Program aims at eliminating leprosy in each of the districts? And your timer starts now.
Team 23 will answer.
Yes, team 23 has raised their hands. Dr. Mahadevan, please answer.
By 2025.
I apologize for that. That's the wrong answer. The question goes on to team 24. Priyadashini Swain and Dharashri Nayak, please answer.
And please turn on your camera.
Please switch on your cameras and please answer.
2002.
I'm sorry, that's the wrong answer again. The right answer is 2030. So we will go for a tiebreaker question to settle the tie. So the tiebreaker question for team 23 and 24 is ZN smear for leprosy shows 1 to 10 bacilli or OIF. What would be the grade report as grading system?
Team 23 will answer.
Yes, team 23.
It's a 3+.
Just a second. Yes, that's the right answer, Dr. Mahadevan. Congratulations, team 23, on getting the right answer. So team 23 proceeds to the next round. Now, the next question will be for team 25 and team 26. Team 25 from Osmania Medical College, Hyderabad, with Syed Mohammed and Naveed Mahmood. And team 26 from IIPHD with Tisha.
Excuse me.
Yes.
I just wanted to say that when I read yesterday in one article they have given us 1955, so I read that 1955. So that's the reason I said 1955.
We are sorry for that,
We are sorry for that.
Vital information from the right website. We are sorry you had got the wrong information. Better luck next time.
But when we are typing in Google also, they are giving us 54, 55. That's the reason I got doubt.
But the right answer is 1955. I think you had answered 1954 and 2002 was the answer.
Sorry. You are saying reverse. I said 1955, but you said it 1954. Like I read in the article 1955, and in Google now when we are searching, it's like 54, 55. So we cannot, I guess, correct one. We can't say, right? Just a small doubt. That's all. No offense.
Ma'am, we'll get back to you. We'll get back. Vishal, Dr. Vishal, you can continue with the quiz. Ma'am, we'll get right back to you.
Okay. Thank you, sir.
So the next question will be between team 25 and team 26. So I hope you are ready for the question. Please turn on your videos and be ready to answer the question. The question for team 25 and team 26 is, so when was the technical guide for management of leprosy published by the WHO? Your timer starts now. Yes. So team 25, Syed Mohammed has raised the hand first. Please answer. Team 25, Zayan Mohammed, please answer.
My guess is 2012.
I'm sorry, that's the wrong answer. The question goes on to team 26. Please answer.
1982.
I am sorry, that is also the wrong answer. It was published in 2020, the right answer. So this was published to provide hands-on course for the medical practitioners to understand the basics of leprosy and Lepre reactions. So it was done in 2020 by the World Health Organization. Now to settle the tie, we'll go on to the tiebreaker question for team 25 and team 26. Be ready. The tiebreaker question for team 25 and team 26 is: identify cell-mediated immune response normal, A. lepromatous, B. tuberculoid, C. intermediate lepromatous, and D. intermediate tuberculoid. Yes. So team 25, Syed has raised the hands first.
Tuberculoid.
Tuberculoid.
Just hold on a second, please. Yes, that is the right answer. Congratulations, team 25, to Syed Mohammed for answering the question correctly. So team 25 proceeds to the next round. Now that is the end of round 1. So I will announce the winners for round 1. In group A, it was group 1, team 1, team 4, team 7, team 9, and team 11. And in group B, it was team 13, then team 15, and it was team 18 from IIHMR Jaipur, and team 20, and team 23. So the teams which have won in the first round are team 1, 4, 7, 9, 11 from group A, and from group B, it is team 13, 15, 18, 20, and 23 and 25. Congratulations on the teams who have answered correctly and proceeded to the next round. Now, the round 2 will start now for group A. The first question will be directed at team 1 versus team 27. So team 1 is from Delhi Pharmaceutical Sciences and Research, Sapna Yadav and Aditya Kupreti, and team 27 is from IIPHD, Alok and Diksha Verma. Due to the nature of the bye, team 27 will be competing now only, and they'll be paired against team 1. So team 1 and team 27, I hope you are ready. Please turn on your videos and be ready to raise your hands when the question is asked. So the question for team 1 and team 27 is: apart from humans, name one animal that has exact strain of the disease and can spread leprosy.
Team 1 will answer.
Yes, team 1, Sapna Yadav has raised her hand.
Its name start from A. Remake. I'm not striking the name.
Any guesses? You can make any guesses if you are not listening, so that we can finalize your answer.
Aramidola something.
You will have to pronounce the name properly in order to advance to the next round, ma'am.
No, I'm not getting it correctly.
Your time is up, ma'am.
Time is up. So team 27, Dr. Alok, please answer.
Sir, it is armadillo.
Yes, that's the right answer. It's actually armadillo and Mangabe monkeys. So they both have a very close strain for contracting the leprosy virus, leprosy strain of the disease, and it can be passed on to humans. It has been identified as a zoonosis type of infection in US and Brazil already. So congratulations, Dr. Alok, for getting the right answer.
Thank you, sir.
So the next question will be for team 4 and team 5.
Sorry for the interference. Sapna, Mrs. Sapna, could you just raise your hand down? Team 1, lower your hand, please.
So team 4 and team 5. The question is for you. Team 4 is from AIMS Jodhpur, Divya Gehlot and Kajal Teluja. Team 5 from North Bengal Medical College and Hospital, Novanil Deb and Paulami Roy. I hope you are ready to answer the question. Please turn on your videos and be ready. The question for team 4 and team 5 is, which was the first modern medicine proposed against leprosy? And your time starts now. All right. So team 4, Kajal Taluja has raised her hands first. Only team 4 has raised their hands. So please answer. I'm sorry, I could not hear you. Could you please repeat the answer? There's some kind of glitch. We are not able to hear you, Kajal Taluja.
Sir, may I answer? Because we are on the same team and we are having network issues.
Yes, you can answer, please.
Sir, it's Dapsol.
Yes, congratulations, team 4. Divya has answered correctly. It's Dapsone. It was the first medicine to be proposed against leprosy, but due to its ineffectiveness, later on multiple drugs were added under the MDT, multiple drug therapy, so that it was effective. So congratulations, team 4, on proceeding to the next round. The next question.
Please lower your hand, participants.
Please lower your hands, team 4. Yes. So the next question will be for team 7 and team 9. Team 7 from IIHMR Delhi, Dr. Lipika Singh and Afrin Hussain, and team 9 from IIHMR University, Jaipur, Dr. Reni Thomas and Manshu Bhatta. So the question for team 7 and team 9 is, from when till when Sparsh Leprosy Awareness Campaign were conducted by states last year? And your timer starts now.
Team 9 will answer first.
Yes, team 9, Glory Samar has raised her hand first. Please answer.
2017 to 2020.
Please read the question correctly. That's the wrong answer. The question is from when till when SLACs were conducted by states last year. So the question is for last year.
Okay.
So team 9, that's the wrong answer. The question goes on to team 7. Please answer. Yes, Dr.
January to March.
I'm sorry, that's the wrong answer again. The right answer is from 30th January to 13th February 2021. It was a tough question, no problem. We'll go to a tiebreaker for team 7 and team 9. The tiebreaker for team 7 and team 9 is other name for leprosy. Wilson's disease, Hansen's disease, Crohn's disease, none of the above. So
team 9 will answer first.
Yes, Glory Samal
Hansen's
again.
disease.
Yes, that's right. Team 9, congratulations. So Glory has answered correctly. It's Hansen's disease. Congratulations on proceeding to the next round. Now the next matchup will be between team 11 and team 28. So team 11 from National Institute of Public Health, Training and Research, Dr. Gauri Tilak and Dr. Mahari Rak. And team 28, SOA University, Gavish Kumar and Barsa Rani. So please be ready, team 11 and team 28, to answer the question. The question for team 11 and team 28 is, what is a suitable temperature for the growth of M. Lepre, Mycobacterium leprae?
Team 11 will answer.
Yes.
It's 30 degrees Celsius. 30. Yes.
Yes, that's the right answer. So I'm really sorry for that. It was 30 to 34. We'll go to the tiebreaker question. I apologize for that. So between team 11 and team 28, please be ready for the tiebreaker question. The tiebreaker question for team is Mycobacterium leprae aerobic or anaerobic? Yes.
Team 11 will answer.
Aerobic.
Team 11, you had put your hands first up, but you have put it down. Are you not sure about the answer?
Aerobic.
So that was team 11, Dr. Gauri. Or team 28?
Anaerobic. Anaerobic, sir. B.
Somebody said aerobic. That was, I think, team 28.
Basarani, team A.
Yes. So Basrani, you are correct. That's aerobic. The answer is aerobic. Congratulations, team 28, to moving on to the next round. So now we'll go to round 2, group B.
Excuse me, sir.
We will keep the questions towards the end. We will conduct the quiz right now. I request the participants to keep any doubts. Is it something very important, team 28?
Yes, sir. My video is not start because the host is stopped my video.
All right, that's not a problem.
Does your teammate have any problem with the video?
No, sir. Thank you, sir.
That's not a problem. It's okay. So we'll go on to the next round. So the next question will be for team 13 and team 14. Team 13 from Tata Institute of Social Sciences, Siddhi Chaudhary, Himani Goyal, and team 15, sorry, it's team 15, IIHMR Delhi, Shreya Vadwa and Dr. Vaibhav Sundria. So team 13 and team 15, I hope you are ready. The question for team 13 and team 15 is, what are the two modes of entry of the Lepre infection? Please answer. So team 13 and
Team 13 will answer.
So yes, please answer. Team 13, Himani.
It transfers via droplets or nasal airways. Nasal.
All right. Is that the only mode?
And epithelial mucosa. We are from the same team. Sorry.
All right.
Nasal and epithelial.
Okay. Could you maybe like reframe the answer a bit better? Like we don't want to know what is inside. You are right about one part of it. What's the other mode of entry for the infection? One you mentioned through the nasal. What is the other mode?
It's upper air. Siddhi, go ahead.
Yeah, droplet infection through the upper airways, respiratory tract. So
all right. All right. So the respiratory tract is right. Epithelial means skin. So indirectly that is the right answer. So the mode of entry of infection is skin and respiratory tract. So congratulations, team 13, for answering it right. All right. So the next question will be for team 20. I'm sorry, just hold on a second. So the next question will be for team 18 and team 20. So team 18 is from IIHMR University, Jaipur with Adameya and Ria. And team 20 is from National Law School of India University, Pallavi Tibarwala, Nutan Tibarwala. So team 18 and team 20, I hope you're ready to answer the question. The question for team 18 and team 20 is, what percentage of global caseload does India account for leprosy in percentage? Please answer.
Team 18 will answer.
Yes, team 18, Adamaya and Riya Ranjan have raised their hands first. Please answer.
So 60%. Around 60%.
I'm sorry. You'll have to be more precise with the answer. So the question goes on to team 20. Please, team 20, please answer.
Sorry, 42, 70%.
No, you'll have to be a little bit more precise with this thing. Considering both the teams have answered, team 18 was the most closest to the answer. So I'll give the victory to team 18 because it is 57%. So the answer was quite close. So congratulations, team 18, on getting the nearby answer, close answer.
Thank you.
So the next matchup will be between, there'll be no matchup since team 21 and 22 are not there. So team 23 will be proceeding on to the next round. You can still regardless answer the question. Team 23, Dr. Mahadevan and Dr. Vishwanath. The question for team 23 is?
Vishal, shall I skip this question or they'll
Yeah,
answer this?
they can answer. If they want, they can answer the question.
Okay.
It's doesn't matter if you get it right or wrong. So the question is, name the top 2 countries with the highest prevalence of leprosy.
India and Brazil.
Yes, that's correct. Team 23. That's the right answer. And the final matchup for round 2, Group B, will be between team 25 and team 29. So team 25 is from Osmania Medical College, Hyderabad, and team 29 is from RVS Agricultural College, Tanjavur, Manikandan A and Manoj M. So team 25 and 29, I hope you're ready for your question. The question for team 25 and team 29 is, which scientist was nominated for the Nobel Prize in medicine for his experimental anti-leprosy vaccine? Please answer. Please raise your hands. Team 25 and team 29.
Team 25 will answer.
So team 25, Syed Mohammed has raised his hands. Please answer.
So J. Convict.
Yes. Could you be more precise?
I don't know. I forgot. It was J. Convict.
Yes, you are right. You got the part of the name, but you can say, if you can say the full name.
I have Johann Convict.
All right. It's Jacinto Convict Garcia. So that was the close by answer. Do we have a tiebreaker for this question for team 25 and 29?
Yes, we have.
So we can go on to the tiebreaker. For team 25 and team 29, please be ready. Which age group is at most risk for leprosy? 10 to 15 years of age, 30 to 60 years of age, above 60, both A and B. Yes, again Syed Mohammed from team 25.
Option A, 10 to 15 years of age.
I'm sorry, that's the wrong answer. Team 27, please answer.
Team 27, if you could answer the question.
Sir, it is.
It's both. Yeah,
It
go
will
ahead.
be answered with by Diksha, sir.
Yes,
both
please
A
answer.
and B.
It's both A and B.
Yes, that's the right answer. It's both A and B. Congratulations, team 27. for getting the right answer. Sorry, team 29 for getting the right answer.
Sir, actually, it's team 27.
The question was for team 25 and 29.
Yeah, but you actually announced 27. That is why we raised the hand. Like in the middle, you said 27.
So do we have another tiebreaker for this team 20? I apologize for that, for any miscommunication. It's for team 25 and team 29 only. All right. So team 29, please switch on your videos. I will ask you another verbal tiebreaker question. Please be ready to answer.
So,
All
sir,
right.
we answered half the right answer for the first question, and team 29 is not there in the meeting, I think.
Can somebody please reconfirm this? Is team 29 not there? So we can give a walkover to
Yes,
team 29.
they are not there. They are not there.
So team 25 proceeds to the next round. And they did get the answer quite close, but not quite correct. Not a problem. So congratulations, team 25, Syed Mohammed. All right. So that's the end of round 2B. So
I'm sorry for interfering, Dr. Vishal. Please, I would request other teammates and other participants to please not raise their hands if the question is not for them, because that caused confusion before. So thank you so much for understanding. Vishal, you can go ahead.
Yes. So the victors for team round 2, group A are 27, team 27, team 4, team 9, team 28. And for round B, it is team 13, team 18, team 23, and team 25. Congratulations to all the teams on proceeding to the next round. So the next question. So the next question will be for team 27 and team 4. Team 27 and team 4. So now it's the turn of team 27 and now it's turn of team 4. So please be ready, team 27 and team 4, to answer the question. The question for team 27 and team 4.
For the first matchup, we have 3 questions for team. Okay.
Sorry, we were unable to listen.
Yes, so that will be from round 3 onwards, as it was explained earlier by Dr. Shravan. There will be 3 questions per matchup. So team 1 and team 27, team 27 and team 24 will have the first matchup, and they will have 3 questions to be answered. Whoever gets the majority of the answers right will proceed to the next round. Is that clear?
Excuse me, did you say team 4 or
Vishal, I think
24?
the teams are team 4 and team 27.
Yes, ma'am. Team 4 and team 27. So team 4 and team 27, yours will be the first matchup. There will be 3 questions, and whoever gets the answer to the majority of the question will proceed on to next round. So team 27 and team 4, please be ready. So the first question for team 27 and team 4 is, please identify the image. Who's this person?
Team 27 will answer.
Yes, team 27. Diksha, please answer.
It's Dr. Hansen.
Team 27, kindly switch your camera on.
Yes, I would request you to switch on your cameras.
My teammate has switched on his camera. Actually, I'm not unable to do it. It is like the host has disabled my video.
All right, not a problem. Regardless, that answer was right. So congratulations, team 27, on getting the first question right. All right, so the second question for team 27 and team 4. So the second question for team 20, in case of paucibacillary leprosy, treatment is considered adequate if the patient has received the 6 monthly doses of combined therapy within 6 months, 9 months, 12 months, 15 months.
Team 4 will answer.
Team 4, Divya, please answer. Please unmute yourselves to answer.
Sir, 6 months, I said.
I'm sorry, team 4, that's the wrong answer. Team 27, you can answer for this. Yes.
Sir, it is 9 months.
That's exactly correct. Dr. Alok, 9 months is the answer. Congratulations. By majority, you will automatically move on to the next round, but still, we will ask you the third question. So team 4, maybe you can get this one right. The last and final question in this matchup between team 27 and team 4. The question for team 27 and team 4, please identify the image.
Team 27 will answer.
Yes, team 27. Diksha?
Sir, it's type 1 Lepre reaction.
I'm sorry, the answer is indeterminate leprosy. No problem. You guys are proceeding into the next round because you have got 2 out of 3 questions correct. Team 4, apologize for it and better luck next time. So congratulations, team 27, on winning the first matchup and proceeding to the next round. So the next matchup will be between team 9 and team 28. All right. So team 9 and team 28, please be ready for your 3 questions. So the first question for team 9 and team 28 is, please identify the type of leprosy.
Team 9 will answer first.
Multibacillary.
Not in terms of the number of this thing, maybe a different answer.
Lepromatous.
Yes. Yes. So I'm so just 1 second. Let me just reconfirm if it is the right answer. Yes, congratulations, team 9, Glory Samar. That was the right answer. It's Lepromatous leprosy. So the next question for team 9 and team 28 is, please, the question, please. The question is not visible. The next question for team 9 and team 28.
It's still not visible.
It's not visible. It's stuck onto the previous question, the first question answer. Apologize for that. That might be some technical glitch. We will reshare the screen again. Please hold on a moment.
We apologize to all the participants for the technical glitch. Just give us some time. We'll be back with you in no time.
No worries.
Currently, we're having a technical network issue. We'll rectify on that and join back you guys. Just give us some more time. Thank you so much, everyone. Until then, I would really like to thank all the participants that took part today. Thank you for making this event successful for us. We thank you with our whole hearts for just participating. Better luck next time. Thank you so much, everyone.
Yes, in just a short moment, the screen will be shared again. I apologize again. We apologize for the delay again. Please hold on a moment. So team 9 and team 28, be ready for your second question. Yes. So the first question, team 9 had answered correct. Lepromatous leprosy. So the next question for team 9 and team 28 is, please show the question. A distinct feature of lepromatous leprosy: A, leonine facies; B, keloid; C, drooping of one side of the face; D, none of the above. So Glory has raised her hand first from team 9, and afterwards team 28 has raised. So Glory, could you please answer?
A, leonine facies.
Yes, that's correct, Glory. That's the right answer. So congratulations, team 9, on proceeding to the next round. Regardless, we'll ask you the third question for team 9 and team 28. Please be ready to answer. Name the diagnostic procedure given in the picture. So team 28 has raised their hands first for this. Barsarani, please answer. You can unmute yourself and answer. It's on mute, team 28. Team 28, you was yes, now you're unmuted. Yes, please answer.
Skin test.
That's right, team 28. That was the right answer, and I apologize. May better luck next time. So congratulations to team 9. Glory Samal has answered both the questions on behalf of team 9 and proceeds to the next round. So that would be the end of the first round 3 first matchup. Now we'll go on to the round 3 group B next matchup. Please hold on.
Team 28, please lower your hand. Parsarani Malik, ma'am, could you please? Thank you.
Yes. So for round 2 group B, the third matchup, that is, it will be between team 13 and team 18. So team 13 and team 18, please be ready to answer the 3 questions when asked. So the first question for team 13 and team 18 is, Why is monotherapy not a viable treatment option for leprosy? A, drug resistance, B, less effective, C, not effective at all, D, due to the side effects.
Team 13 will answer.
Team
Drug
13,
resistance?
Himani.
Yes,
Yes, that's correct. Team 13, it's drug resistance. That's why there is a multi-drug therapy, as it was discussed earlier in the meeting today by the experts. So congratulations on getting the first answer right. So the next question for team 13 and team 18. Please show the question. Erythema nodosum leprosum is which type of Lepre reaction? Type 2 reaction, type 1 reaction, type 3 reaction, or type 4 reaction? So again, team 13, Himani has raised her hands first.
Type 2 reaction?
Yes, you are right. Himani, congratulations from team 13. That's type 2 reaction. So team 13 automatically proceeds to the next round in getting the majority right. Regardless, there's a third question, and hopefully team 18 can answer this. So the third question is, which type of Lepre reaction presents extensive cutaneous ulcerations as shown in the image? Please. It's again team 13 who has raised her hands first. Himani. Yes, please answer. Team 13. Sorry, team 13 Siddhi. Sorry, I apologize for that. Please answer.
Multibacillary.
I'm sorry. Could you answer it? The type 1, type 3, like that? What kind of reaction? It's a Lepre reaction.
Yes, sir. Yes, sir. Sorry. Type 2 Lepre reaction.
Yes, that's right. Team 13 Siddhi. So team 13 has got all 3 answers correct in their matchup. It's type 2 Lepre reactions. Congratulations, team 13, on proceeding to the next round. Please lower your hands. Yes. So the next matchup will be between team 23 and team 25. That is the fourth matchup. So team 23 and team 25, please be ready to answer your 3 questions when asked upon. So the first question for team 23 and 25 in the fourth matchup is, which type of Lepre reaction is this? Please read the question correctly. It's Lepre reaction. So which type of Lepre reaction is this? So team 23, Dr. Vishwanath has raised the hands. Please answer.
Type 1 Lepre reaction.
Sorry?
Type 1 Lepre reaction.
That's the right answer. Congratulations, team 23, on getting the first answer right. It is type 1 Lepre reaction. So the next question for team 23 and team 25.
Please lower your hand.
Please lower your hands, or I will ask the next question and you can raise your hands again at that time. The next question for team 23 and team 25. The question, please. Which one is the causative organism for leprosy? Gram-negative coccus, gram-positive bacillus, gram-positive coccus, none of the above. Yes. So team 25, Syed Mohammed has raised his hands first. Please answer. I guess Syed, you are on mute.
B, gram-positive bacillus.
Yes, that's the right answer. So we have a tie between team 25 and team 23. So team 23 got the first answer right. Team 25 got the second answer right with the gram-positive bacillus. That's the right answer. Now to settle the tie, the last and final question for team 23 and team 25 in this matchup is, please identify the image.
Team 23 will answer.
Team 23, Vishwanath, please answer.
Francis Roller.
I'm sorry, that's the wrong answer. So the question is automatically passed on to team 25. Please answer.
So my guess is the same guess. The Jacinto Convict, is he this guy?
Yes, team 25, you are correct. The guess was right. So team 25 has got the last answer right and proceeds to the next round. So better luck next time, team 23. Congratulations, team 25. So we have the victors for round 3. It is the victors for round 3 are 27, Team 27, Team 9, Team 13, and Team 25. So now on to round 4, we'll have 2 matchups each. So the first matchup with 3 questions will be for Team 27 and Team 29. I hope you're ready, Team 27 and Team 9. So the first question for Team 27 and Team 9 is: hypopigmented spots which undergo healing spontaneously is seen in which type of leprosy? Lepromatous leprosy, tubercular leprosy, indeterminate leprosy, none of the above.
Team 27 will answer.
So Team 27, Dr. Alok, please answer.
Yeah, Diksha, you please go on.
Sorry?
Diksha is my teammate, sir, and I'm telling him to go on with the answer.
All right.
All right, ask your teammate to please go ahead with the answer.
Sir, it is lepromatous type leprosy.
I'm sorry, that's the wrong answer. The team automatically passes on, the question also automatically passes on to the Team 9. Glory, please answer.
It will be tuberculoid leprosy.
I'm sorry again, that's the wrong answer. It is actually indeterminate leprosy. So both the teams have got it wrong. No issues. There are 2 more questions in this round. So here's to hoping that one team answers this thing, or else we'll go to the tiebreaker. All right. So the next question for Team 27 and Team 9.
Sorry to interrupt, but Team 9, kindly lower down your hand.
Yes, Team 9, please lower down your hands. Yes. So the next question for Team 27 and Team 9. The Central Leprosy Teaching and Research Institute is situated in which state? Kerala, Tamil Nadu, Delhi, or Kolkata?
Team 9 will answer.
So Team 9, Glory. Yes.
Yeah. Where do you want to go?
Glory, you can also.
No, Tamil Nadu.
So the answer is, please could you repeat again?
Tamil Nadu.
Yes, that's the right answer. Congratulations to Team 9 on getting the first answer right in the matchup. It is Tamil Nadu.
Dr. Rennie, could you please? Thank you so much.
Yes. So the last and final question for Team 27 and Team 9 in this matchup. The question, please. The major concern of the National Leprosy Eradication Program is to detect cases of leprosy at an early stage and to provide complete treatment at a lower cost in order to prevent occurrence of grade 2 disability in affected persons. Is this statement true or false?
Team 9 will answer first.
Team 9.
True.
I'm sorry, that's the wrong answer. By the nature of the question, it's understood that it is false, because the aim is to provide the treatment at free of cost, not at lower cost.
Right.
So we have to go on to a tiebreaker question. Please wait for a moment. I will ask you verbally a tiebreaker question for Team 9 and Team 27. Please be ready to answer when I ask it.
And please lower down your hands.
Please lower down your hands for now.
Please turn on your camera, Diksha. 27B Diksha, can we see you, please?
Yes, ma'am. Just give me a minute, ma'am. I'll log in through another device because not able to.
All right. The tiebreaker question for Team 9 and Team 28. So this should be quite easy. Leprosy is which kind of infection? The options are viral, fungal, bacterial, or protozoal.
Team 9 will answer first.
Yes, Team 9, Glory.
Then you want to go?
Yeah, you go ahead. No issues. Go ahead.
Sorry, could you repeat the options again?
Leprosy is which kind of infection? Is it a viral infection, fungal infection, bacterial infection, or protozoal infection?
Bacterial.
Yes, that's right. Team 9. You raised your hands first, so you could answer it correctly. So Team 9 proceeds to the next round. I apologize to Team 27. Better luck next time. Congratulations, Team 9, for proceeding to the finals. Now it will be the next matchup between Team 13 and Team 25. Team 13 and Team 25, please be ready to answer the 3 questions when asked upon. please turn on your videos. So the first question for team 13 and team 25. Please show the question. Name the software which is a real-time leprosy reporting software implemented across India. Arogya Setu, Nikusht, Umang, Kova.
Team 13 will answer.
Team
So do you
13,
wanna go?
Himani.
Nikusht. It's Nikusht.
Yes, that's right. Congratulations, team 13. Himani has answered the question correctly. It's Nikusht. So the next question for team 13 and team 25 is, in which state of India the Aswamedham campaign was held? It is Karnataka, Andhra Pradesh, Madhya Pradesh, or Kerala?
Team 25 will answer.
Yes, team 25.
Kerala, it's Kerala.
Yes, that's correct. It's Kerala. Congratulations, team 25. So there is a tie now between team 13 and team 25. So the final question to break the tie, here's to hoping one of the teams gets it right. The final question for team 13 and team 25. One of the strategies for leprosy elimination in India is information, education, and communication activities in the community to improve self-reporting to primary health care center. And reduction of stigma. True or false?
It's true.
So team 25, please, I would request, yes, you had raised your hands first, but please, I would request you be called upon and then answer. But regardless, team 25, that's the right answer. Yes, that's the right answer. Congratulations. So team 25 proceeds to the last round by getting 2 answers correct in the matchup. Team 13, better luck next time. So now it will be the final matchup between the 2 final teams, which is team 9 and team 25. I wish you all the best. So here are the questions from team 9.
Just a moment, Vishal.
Yes, ma'am.
The team has to raise their hand once the question has been read out, not before that.
Yes, ma'am. Please, teams, follow the instructions appropriately. Please raise your hands once the question has been completed. You can raise your hands after that. All right.
25B, please turn on your camera. Sorry to interrupt. But Zen, can you please turn on your camera? Thank you.
So the final matchup between team 9 and team 25. Please put on your hands, team 13.
So could we please have a tiebreaker for our question then, since the hands were raised before the question was completely read out?
I'm sorry, the question was on screen. Please understand that they have won it fairly and squarely. I apologize, team 13. Better luck next time. I hope you do well. But for now, we'll have to proceed with the finals.
Okay, sir.
Yes, please. So the last round is between team 9 and team 25. Okay. So the first question for team 9 and team 25 in the final matchup. Failure of activation of which cell causes leprosy? Please put down your hands. Please let me finish the question.
Upon I had clearly mentioned, if there is breaking of rules, you might have to be rusticated. So please be careful. Do not break the rules and go within the rules. Only raise your hand upon the question is done.
Completely.
Thank you so much.
Yes. So the options are TH2 cell activation, TH4 cell activation.
Excuse me. Their hands are still raised. So like
TH1 cell activation. Ambi, could you reset the timer?
Yeah, please.
Yes. So please answer that your timer starts now. So team 25 has raised their hands first. Please answer, Syed Mohammed. I guess team 25, you're on mute.
Option C, TH1.
Yes, that's the right answer. So congratulations, team 25, on getting the first question right. I request, please wait for the question to be completed. Please let me finish dictating all the options and then you can raise your hands when the timer starts.
Wait, we should raise the hand when the timer starts, right?
Yes.
Okay.
So please, the next question for team 25 and team 9. Elimination criteria for leprosy is defined as less than 1 case per 1,000 population, less than 1 case per 10,000 population, less than 2 case per 1,000 population, less than 2 case per 10,000 population. Your time starts now.
Team 25 will answer.
Team 25.
Oh, it's
Less than 1 case per 10,000.
yes, it's option B, 1 case, less than 1 case per 10,000 population.
You are right, Team 25. Congratulations. You have got 2 questions in this round correct. Regardless, we'll ask the third question to both the teams. Please display the question for both the teams. The final question for Team 9 and Team 25. How much welfare allowance is provided under National Leprosy Eradication Program? Here are the options. Please raise your hands. Yes, Team 9 has raised their hands first this time.
50,000.
I'm sorry, that's the wrong answer. So Team 25 can maybe answer this thing.
Is it 8,000?
Yes, that's right. Team 25, it's 8,000. Congratulations, Team 25, for securing the victory. And the runner-ups are Team 9. And to all those who have participated up until now, I hope you people are satisfied, and I apologize for any inconvenience caused, and better luck next time. I hope you to see all of you people in a next quiz competition soon. Thank you all for participating, and congratulations Team 25 and congratulations Team 9 on being the runner-up.
So with this, we have come with the conclusion that Team 25 has won and Team 9 are the runner-up. Team 25, could you please introduce yourself to us?
My name is Syed Muhammad, and I'm doing my MBBS second year from Osmania Medical College, Hyderabad.
All right. Do you have a teammate? Where's your teammate?
Yeah, I'm here.
Okay.
Hi, my name is Zayan Muhammad Khan. I'm a student of Osmania Medical College, currently pursuing in the second year MBBS, and I am Syed's classmate.
All right. Congratulations.
Thank you.
And Team 9, please introduce yourselves.
Yeah, please go ahead.
So my name is Dr. Remy Thomas, and I'm pursuing my MBA HM second year from IIHMR University, Jaipur.
All right.
Hello, everyone. Yeah. Hello, everyone. This is Gauri Samal, and I am pursuing MBA Hospital and Health Management first year from IIHMR University, Jaipur.
All right. Thank you, Team 9 and Team 25. Congratulations to both of you, and congratulations to all the participants, because participation is the most important thing. And with this, we will conclude the show, and we will have the vote of thanks by Mr. Wamshi.
Hi everyone, and first of all, congratulations for the winners and runners, and better luck next time for the people who are not able to get into the finals. And I especially thanks Dr. Sudhakar ma'am, Ms. Divya Agarwal, and Dr. Preeta and Dr. Gavish to get the insights of leprosy and as well as the progression of leprosy treatment in India. And especially, I want to take my gratitude to the coordinators who felt their nights to hand slept and created this quiz event as one of their masterpiece. And I always congratulate the people who work in a team and hope for the best and looking down the line with you at IIHMR. Thank you.
Can I just say something?
Yeah, you go ahead.
I'm sorry, I don't want to offend anyone, but like when we are expected to play fair, I guess even you must conduct a fair game, right?
I guess Team 19 is for this thing for 1955. That
No, not that. See, when the other teams are absent, you cannot directly like send the which teams are there to the next round. You can actually.
Mr. Vasudha ma'am, this is a knockout fixture. We had sent mails to you. The knockout fixture, the nature of knockout fixture is as such. There were teams that went directly to the second round without even playing the first round, because we got an odd number of teams. So when there is a team which is backing off at the last moment, the other team gets lucky and moves ahead. We totally understand your feeling, but we are really sorry for the unfortunate event. So thank you so much for participating with us.
Okay.
So I thank everyone for participating and giving us your time for today. Thank you all.
Okay, Shravan, can we have a group photograph for all the participants?
Yes,
Who are
yes.
present? So please switch on your videos, and all of you, please switch on the videos. I request everyone to please switch on the videos. Mamshi, is it done?
It's done.
Thank you so much, and congratulations, heartiest congratulations to all the winners, and wish you all the best for all your future endeavors. Have a good evening. Bye-bye.
Thank you, ma'am. Thank you, sir.
Thank you, ma'am. Bye-bye, ma'am.
Thank you so much, ma'am.